A vaccine is this frontline worker's best hope for protection from the coronavirus and for those around her.
Most especially my workplace, with the elderly, to protect them.
The vaccine is 95% effective against getting sick, but not necessarily against carrying the coronavirus and spreading it. Despite approving the Pfizer-BioNTech and Moderna vaccines, the U.S. drug regulator concluded for both clinical trials the data are limited. And the UK's said the new AstraZeneca vaccine may not prevent transmission.
It's probable, got to be careful with my words, it's probable that they will be less likely to transmit the infection to others compared to someone who wasn't vaccinated and has COVID-19 and has more severe symptoms.
But to know for sure, scientists need more research.
Well, we actually have no data on that.
This U.S. researcher is leading a huge project to recruit students at 20 American colleges after they've been vaccinated to test them daily to see if they've still been infected by the virus and passed it on.
The students were congregated together, so they're a close community, so we could actually get it done. And we actually know even with influenza, you can get a vaccination, you can still get infected, you can still transmit it.
That's why scientists want to see evidence of what's called sterilizing immunity, the complete elimination of the virus. If that doesn't happen with the first generation of vaccines, expect public health measures to remain in place.
But once we get to the point that we're able to get transmission down to a low enough level, we have a broad number of people that are, have been vaccinated within our population, those transmission rates are going to drop substantially.
For those on the front lines, that can't come soon enough. Vic Adopia, CBC News, Toronto.
Let's bring in infectious disease specialist, Dr. Susie Hoda. And Dr. Hoda, we just heard in that story that we don't know whether the vaccines will prevent people from spreading coronavirus. So what do we make of all of this information?
That's absolutely right. The vaccines that we have in Canada right now have been designed to be studied for how well they can prevent symptomatic infection. We don't know if people can still get asymptomatic infections and spread virus that they might be shedding to others after they've been vaccinated. There's some preliminary information from the Moderna trial in particular that suggests that it probably will have some reduction in transmission risk or asymptomatic infection, but we simply need more research to substantiate that. So the take-home messages are, after getting vaccinated, people still need to continue with masking and public health measures that are in place as we gather more information and roll out more vaccination. But the other part of it is, recognizing that it's still very valuable to have these vaccines because they can prevent the harms that are associated with COVID-19 infection. So prevent people from getting sick from it, prevent the healthcare system from getting overwhelmed. And these are definitely worth, us pursuing.
I'm curious about your perspective from the University Health Network in Toronto. From what you're seeing, how is the vaccine rollout coming along?
Well, it always seems like you can never be quick enough with rolling out vaccine. But I did want to acknowledge that a huge amount of work has gone into what we've done so far. Setting up clinics that are high volume, that have all the processes in place with all the operations on the back end, with pharmacy and with the booking systems, the documentation, the consenting, all of that. But also getting mobile teams together that actually go into long-term care homes and retirement homes and vaccinate the residents as well as the staff there who have had barriers to actually coming to the clinic. And that's been hugely successful and really important to emphasize because, to date, 70% of deaths associated with COVID-19 have been within long-term care. So this can have a huge impact. It's been a very positive experience, but also challenging, particularly around all the uncertainties. We don't know when we're going to get our next shipment of vaccine, and so much hinges on those kinds of details. And sometimes even the quantity of vaccine that we're expecting to get might change in the last minute. So lots of troubleshooting as part of the process of rolling out to date, but a lot of collaborative work to actually get it done.
Dr. Hoda, always nice hearing from you. Thanks.
Thank you.